Imagine this for a moment. You're at home, the phone is in another room, the house is quiet. Suddenly, a strange pressure grips your chest, your breathing feels heavy, your arm begins to ache. In that moment, one thought flashes through your mind: what if no one is here to help me? For many people over 60, this situation is very real. Heart attacks often strike when a person is alone, and the first few minutes decide everything. The good news is that knowing what to do can save your life. As we grow older, our bodies often speak to us in quieter, subtler ways, and this is especially true when it comes to heart attacks. After the age of 60, recognizing the early warning signs can truly mean the difference between life and death. Many seniors expect a heart attack to feel sudden and dramatic, but in reality, it often begins gently, almost deceptively. The body sends signals hours, days, or even weeks in advance, yet these signals are frequently ignored or misunderstood. One of the most common warning signs is discomfort in the chest. This may not feel like sharp pain. Instead, it can feel like pressure, tightness, heaviness, squeezing, or a burning sensation. Some people describe it as feeling like something heavy is sitting on their chest. This discomfort may come and go, which leads many seniors to dismiss it as gas, indigestion, or muscle strain. However, chest discomfort that feels unusual, persistent, or unexplained should never be ignored. Another early sign is pain or discomfort that spreads beyond the chest. This can include pain in the left arm, both arms, shoulders, neck, jaw, or upper back. Jaw pain is particularly common in older adults and women, and is often mistaken for dental problems. If jaw or arm pain appears suddenly or alongside other symptoms, it should raise immediate concern. Shortness of breath is another serious warning sign. You may feel breathless even while resting or doing simple tasks like walking across the room. This can happen with or without chest discomfort. Along with this, many seniors experience dizziness, lightheadedness, or a feeling of weakness, as if the body is about to give up. Sudden fatigue that feels overwhelming and out of proportion to activity is also a common early signal. Nausea, vomiting, cold sweats, or clammy skin can also occur during a heart attack. These symptoms are often mistaken for flu, food poisoning, or anxiety, especially in older adults. Women and seniors are particularly likely to experience these less obvious signs rather than intense chest pain. The most dangerous mistake is waiting and hoping the symptoms will pass. Time is critical during a heart attack, and every minute of delay increases damage to the heart muscle the moment something feels wrong or different from your normal state. It is safer to act than to wait. Listening to your body, trusting your instincts, and taking early symptoms seriously can save your life. Knowing these warning signs gives you power, and that power can keep you alive. As we grow older, one of the most important decisions we may ever have to make is when to ask for help, especially during a medical emergency like a heart attack. Calling emergency services immediately is not a sign of weakness or panic. It is a powerful, life-saving action. After 60, the heart is more vulnerable, and every minute during a heart attack matters. The faster medical help arrives, the greater the chance of survival and recovery. Many seniors hesitate to call emergency services because they are unsure if the symptoms are serious enough. They may think the discomfort will pass, worry about bothering others, or fear embarrassment if it turns out to be a false alarm. This hesitation can be deadly. Heart attacks often begin with mild or confusing symptoms, and waiting for certainty wastes precious time. It is always safer to call and be wrong than to wait and be too late. The moment you feel unusual chest pressure, spreading pain, sudden shortness of breath, dizziness, or extreme weakness, you should call emergency services. Do not try to tough it out. Do not lie down and hope it goes away. Do not wait to see if you feel better in a few minutes. Emergency responders are trained to handle these situations and can begin treatment the moment they reach you, even before you arrive at the hospital, when you call. Put your phone on speaker so you can keep it close. This allows you to follow instructions while keeping your hands free. The dispatcher may guide you on breathing, positioning your body, or other steps that can help keep you stable until help arrives. Staying connected also means that if your condition suddenly worsens, someone is already aware and responding. It is also important to unlock your door if you are able to do so safely. This saves valuable time for emergency responders who may otherwise struggle to enter. Sit or lie down in a comfortable position and avoid walking around, as movement can put extra strain on your heart. Never attempt to drive yourself to the hospital during a heart attack. Losing consciousness behind the wheel can endanger your life and the lives of others. Emergency vehicles are equipped with oxygen, medications, and life-saving tools that a personal car does not have. Calling emergency services immediately is one of the most critical choices you can make after 60. It turns fear into action, uncertainty into protection, and precious minutes into a second chance at life. As we grow older, understanding how simple actions can save our lives becomes incredibly important. Especially during a heart attack, one such action is taking aspirin, a small tablet that can make a life-saving difference when used correctly. Aspirin works by reducing the ability of blood to clot, which is critical during a heart attack because most heart attacks are caused by a clot blocking blood flow to the heart muscle. When a heart attack begins, a blood clot often forms around a ruptured plaque in a coronary artery. This clot limits or completely blocks oxygen-rich blood from reaching the heart. Aspirin helps by slowing down this clotting process, allowing more blood to continue flowing until medical help arrives. This can reduce damage to the heart muscle and significantly improve survival chances. However, aspirin should only be used if your doctor has already told you it is safe for you. Some seniors have conditions such as stomach ulcers, bleeding disorders, or allergies that make aspirin unsafe. This is why it is so important to discuss aspirin use with your doctor before any emergency occurs. Knowing in advance removes confusion and hesitation when every second counts. If aspirin is approved for you and you suspect a heart attack, chewing one regular strength aspirin is recommended rather than swallowing it whole. Chewing allows the medicine to enter the bloodstream faster, which means it can begin working more quickly. Faster action can slow the growth of the clot and buy valuable time until emergency responders arrive. It is important to remember that aspirin is not a cure and should never replace calling emergency services. Some people make the dangerous mistake of taking aspirin and then waiting to see if they feel better. This delay can be deadly. Aspirin is meant to support emergency care, not replace it. Always call for medical help first or immediately after taking it. Another common mistake is taking more aspirin than recommended. More is not better. Taking too much can increase the risk of serious bleeding, especially in older adults. One properly chewed tablet is enough unless emergency professionals instruct otherwise. Keeping aspirin in an easily accessible place, such as a bedside drawer or kitchen cabinet, can make a critical difference. Let family members know where it is stored and keep it within reach, especially if you live alone. For seniors, preparation is power. Knowing whether aspirin is safe for you, understanding how it works, and using it correctly during a heart attack can protect your heart and give you a fighting chance. When combined with fast emergency care, this small tablet can help turn a frightening moment into a life-saving one when a heart attack strikes and you are alone. Small practical actions can make a life-saving difference, and one of the most important is unlocking your door and positioning your body properly. In moments of fear and discomfort, this step is often forgotten, yet it can save precious minutes when emergency responders arrive. Time is critical during a heart attack, and anything that helps medical help reach you faster improves your chances of survival. If you are physically able. Unlocking your front door immediately after calling emergency services is a smart and protective decision. Emergency responders lose valuable time if they have to force entry or search for another way inside. Even a delay of a few minutes can increase damage to the heart muscle. By unlocking the door early, you remove one more obstacle between you and life-saving care. After unlocking the door, it is important to sit or lie down in a safe, comfortable position. Do not walk around, pace the room, or attempt to gather belongings. Movement places extra strain on the heart, which is already struggling. Sitting down reduces the heart's workload and lowers the risk of fainting or collapsing. Unexpectedly, if possible, sit in a chair with your back supported and your head slightly raised. If lying down feels better, lie on your back with your head and shoulders elevated using pillows. This position helps breathing and reduces pressure on the chest. Avoid lying completely flat, as this can make breathing more difficult for some people during a heart attack. Remaining still also reduces the risk of injury. Heart attacks can cause sudden dizziness, weakness, or loss of consciousness. Standing or walking during this time increases the chance of falling and causing additional harm. Sitting or lying down keeps you safer until help arrives. While resting, focus on staying calm. Fear causes the heart to beat faster and raises blood pressure, increasing strain on the heart. Slow, deep breathing can help steady your body and mind. Inhale gently through your nose, pause briefly, and exhale slowly through your mouth. This simple action can help you remain conscious and stable. Many seniors believe they must stay active or fight through it, but the opposite is true. Rest is protection. Sitting or lying down is not giving up, it is giving your heart a better chance to survive. Unlocking the door and resting may seem like small steps, but during a heart attack, small steps save lives. These actions buy time, reduce stress on the heart, and allow emergency responders to reach you quickly. In a moment where every second matters, calm preparation and stillness can truly be life-saving. When a heart attack begins, fear often becomes as powerful as the physical symptoms themselves. The sudden pain, tightness, or shortness of breath can trigger panic, and panic places extra strain on an already struggling heart for someone over 60. Learning how to stay calm and control breathing during this critical moment can be life-saving. While it may feel impossible to remain calm, even small efforts to slow your breathing can make a real difference. Fear causes the body to release stress hormones that speed up the heart rate and raise blood pressure. This forces the heart to work harder at a time when it needs rest and oxygen. Rapid, shallow breathing can also reduce the amount of oxygen reaching the heart and brain, increasing dizziness and the risk of losing consciousness. This is why controlling your breathing is not just about calming the mind, it is about protecting the heart. If you suspect a heart attack and have already called emergency services, focus your attention on your breath. Try to breathe slowly and deeply rather than quickly and shallowly. Gently inhale through your nose for a few seconds, allowing your chest and abdomen to rise. Hold the breath briefly. Then slowly exhale through your mouth. A slow exhale is especially important, as it signals the body to relax. Repeat this pattern steadily, without forcing it. You may notice your thoughts racing or your body trembling. This is normal. Instead of fighting these feelings, acknowledge them and return your focus to breathing. Some people find it helpful to silently count during each breath or repeat a calming phrase in our mind. This keeps panic from taking over and helps maintain control during a frightening situation. Controlled breathing helps stabilize heart rhythm and improves oxygen flow throughout the body. It can reduce chest tightness, ease shortness of breath, and help prevent fainting. Staying conscious is crucial, especially when you are alone and waiting for help to arrive. Even a few minutes of calm breathing can help preserve strength and awareness. It is important to understand that staying calm does not mean ignoring the seriousness of the situation. You are not minimizing the danger, you are responding wisely. Panic will not save you, but calm actions can. Emergency responders often say that patients who remain calmer and follow breathing guidance have better outcomes during cardiac events. For seniors, practicing calm breathing even before an emergency happens can be helpful. Learning this skill ahead of time makes it easier to use when fear strikes. In the critical moments of a heart attack, slow breathing becomes a tool, one that costs nothing, requires no equipment, and can help keep you alive until help arrives when a heart attack begins. One of the most dangerous mistakes a person can make is trying to drive themselves to the hospital. This decision often comes from fear, urgency, or the belief that driving will be faster than waiting for help. In reality, attempting to drive during a heart attack puts your life and the lives of others at extreme risk. Especially after the age of 60, a heart attack can cause sudden dizziness, blurred vision, confusion, weakness, or even loss of consciousness without warning. You may feel good enough to start driving, but your condition can worsen within seconds. Losing control of a vehicle during a cardiac event can lead to serious accidents, injuries, or death before you ever reach medical care. What feels like taking action can quickly turn into a tragic situation. Emergency medical services are far more than just a ride to the hospital. Ambulances are equipped with oxygen, heart monitors, defibrillators, and medications that can begin treating the heart attack immediately. Trained professionals can monitor your condition, stabilize your heart rhythm, and respond instantly if your heart stops or your breathing becomes difficult. A personal vehicle cannot provide any of this life-saving support. Another important factor is time. While it may seem faster to drive yourself, emergency responders can often reach you quickly and begin treatment on the spot. Hospitals are also alerted in advance when a heart attack patient is arriving by ambulance, allowing doctors and equipment to be ready the moment you enter. This preparation can save critical minutes and reduce damage to the heart muscle. Some seniors hesitate to call emergency services because they do not want to cause trouble or feel embarrassed if it turns out not to be a heart attack. This thinking is dangerous. Medical professionals would much rather respond to a false alarm than arrive too late to save a life. Your safety is always the priority. If you are alone and experiencing heart attack symptoms, stay where you are after calling for help. Sit or lie down, keep the phone nearby, and focus on staying calm and breathing steadily. Let trained professionals come to you. Choosing not to drive yourself is not weakness, it is wisdom. Remember this clearly. During a heart attack, the safest seat is not behind the steering wheel. It is where help can reach you quickly. Waiting for emergency medical care gives you the best chance to survive, recover, and continue living the life you've worked so hard to build. Repairing before a heart attack ever happens is one of the most powerful steps a senior can take to protect their life. Emergencies rarely give warnings, and when they strike, fear and confusion can make even simple actions difficult. Preparation removes hesitation and replaces panic with clear, automatic responses. After 60, this kind of readiness can truly save your life. Start by keeping emergency phone numbers easily accessible. Store them on speed dial, write them on a card near your phone, and place them where you can see them quickly. If you use a mobile phone, keep it charged and close to you at all times, especially at night. A dead or distant phone during an emergency can cost valuable minutes if you have heart disease, high blood pressure, diabetes, or take regular medications. Wearing a medical alert bracelet is extremely helpful. This allows emergency responders to understand your condition instantly. Even if you are unable to speak, keep a list of your medications, allergies, and medical history in an easy-to-find place, such as your wallet or bedside drawer. Living alone makes preparation even more important. Let a trusted neighbor, friend, or family member know to check on you regularly. Share spare keys if possible, and let someone know your daily routine so unusual silence raises concern. Keep essential items like aspirin, water, and your phone within reach. Preparation does not create fear, it creates confidence. Knowing that you are ready brings peace of mind and gives you control in a frightening situation. When a heart attack strikes, preparation turns seconds into survival and gives you the best possible chance to live on.